Well, surgery is one aspect of the whole process of recovering from a condition. So, not necessarily true that surgery is the end of the treatment. For example, some conditions where there is a complex recovery process, for example, a condition like anal rectal malformation or Hirschsprung's disease, where we reconstruct anuses or bowel, they need time to get to normal functioning. Some of these may take years before they get in normal function. So surgery may be the first, but subsequent care of the child and management, for example, bowel management, will be done by the surgeon so that they get to normal functioning, usually by the age of 5, so that the rest of their life they are normal in functioning.
Dr. Nada, surgeries on children always results in large, noticeable scars. Is that true or false?
The traditional surgery will lead to large scars. Yes, that's true. However, the option of laparoscopic or keyhole surgery or thoracoscopic surgery will invariably leaves you with tiny scars and faster recovery. So what you need to do is identify surgeons who will offer your child keyhole surgery so that the recovery and the long-term outcomes of scarring is excellent.
Dr. Nada, the experience of surgery is too traumatic for children, often affecting their psychological well-being in the future. Is that true or false?
Yes, to a certain extent, this is true. However, what we look at is the whole process of surgery so that the psychological process and psychological trauma for the child is as minimal as possible. So, for example, one of the things that pediatric surgeons are trained to do is to deal with the psychological aspect for the child as well as for the parents. So, look out for a child surgeon for your child, not an adult surgeon. Secondly, the process can be improved by making the pain and the stress of the surgery as minimal as possible. Therefore, look out for a surgeon who provides minimally invasive surgery or laparoscopic surgery. And finally, the age at which the child is undergoing surgery also is important. Most children will not remember much about the surgery or what happened to them before the age of 4. So ideally, things that are identified close to birth is best done even as an elective procedure before the age of 4, so that the psychological trauma for your child is minimal and that they don't remember it when they are much older.
Dr. Nada, surgical intervention on children is rare and only used for severe conditions. Is this true or false?
Surgery for children is not as uncommon as you would expect. As a pediatric surgeon, I'm busy doing surgeries almost daily, so it's not uncommon. The cases that we see, some of which are serious and severe, and some of which are minor. So the things that are minor, for example, a child with tongue tie or a child with an inguinal hernia, they are as common in the child as it is for the adult population. Other conditions, such as more complex conditions, for example, Hirschsprung's disease, anal rectal malformations, cervical atresia, these are all very rare conditions and occur in about 1 in 5,000 or 1 in 10,000 kids. So yes, they are rare. They are more severe, more complex in nature for the surgery. However, if needed, then they need surgery too.
Dr. Nada, parents can't be involved in the surgical process. They are not allowed to be part of it. Is that true or false?
Parents are always needed in the surgical process for the child. One, they need to be involved so that they can give the consent for surgery and also understand thoroughly what the child is going through, because they are the support for the child before, during, and after the surgery. So they need to be completely involved and be supportive for the child. Often I find that it is very difficult for parents to make decisions for their child for surgery because they're making a choice for somebody that they love compared to making a decision for themselves. It is easier for decision for yourself to undergo surgery versus someone that you love, especially your child. So they are involved with the whole surgical process. And also during the surgery, the child needs to be with their parents all the way from the ward down to the operating theater. And the child is with the parent when they're having anesthesia. And as soon as the surgery is done, when the child wakes up, the parent is there to be with the child, so that the child at any point is aware that the parent is with them and is not frightened at all, so that the long-term outcome and the long-term psychological stress for the child is minimized.